Okay, so now we're going to talk about some childbirth choices and education about the birth process. First of all, someone who's giving birth can choose among several practitioners. They can choose a physician who is an OBGYN. They can choose a physician who's a family practitioner. Many family practitioners don't actually do deliveries, but there are still some family practitioners who do OB, labor and delivery. They could choose a certified nurse midwife. CNM is an RN who's gone on for an additional degree and is licensed to practice as a midwife. A certified professional midwife. In some states, you can obtain a certification as a midwife without being a nurse previously. So you would attend courses, complete education. Generally, there's going to be some clinical involved with that. And then become a test to become a certified professional midwife. There are independent or lay midwives, and this is where it gets a little bit dicier because someone can, depending on the state, someone can decide they want to be a midwife, and then they determine the path they take to get there. So some independent midwives have done really long apprenticeships, and they've had a lot of experience before they begin practicing on their own. Some states don't regulate that though, and so it's possible for people who don't realize how much they don't know to begin practicing as a midwife. So an independent midwife, you really want to encourage patients to do their research as far as the qualifications of that person. A doula actually doesn't deliver the baby and doesn't provide any medical care. A doula is there as a support person through the labor for the patient. And that role sometimes is played informally by family members. A doula is a paid formal person who's there, support person for labor and delivery. Unassisted birth, there are parents who choose to give birth without any medical assistance. Obviously, that has a lot of medical risk because they may or may not be able to identify complications, and then they probably are not going to have the training to handle those complications if they occur. So those are choices. There are risk and benefits to different choices. Birth settings, people can choose to deliver in the hospital. We used to have this traditional labor, delivery, recovery room. So we'd labor in a room, and then we would say, okay, don't push. We're going to go over here. Now we're ready to push. So we're going to go to the delivery room. And then after delivery, we're going to pack them up and go to a recovery room. And then after recovery, we pack them up and take them to a postpartum room. Now it's much more common to see either an LDR or an LDRP setup in the hospital. In an LDR, the patient labors, delivers, and recovers all in one room. In a lot of cases, the infant is also recovered in that same room, so they're not actually separated for that initial recovery and monitoring period. And then once the recovery period is over, the mother and baby are moved to a postpartum room. Some facilities also have LDRPs in which everything happens in one room. They labor, deliver, recover, and then that room is a postpartum room as well. There are facilities that do couplet care. So all nurses in the mother-baby unit can take care of mothers or newborns, and they are assigned to couplets. There are facilities that separate mother and newborn care. And in that case, a lot of times there's cross-training, so nurses could do either one. In bigger facilities, newborn nurses may never have done postpartum and vice versa. So if mother and newborn care are separated, then we're going to have a nurse for the baby and a nurse for the mother. Those are all different options for how care is structured in hospitals. Birth centers are places that are set up just for giving birth. Most of the time in a birth center, the postpartum admission is for a shorter time period. Sometimes it's extended more like a hospital stay, but most of the time it's for a shorter time period, and a few hours after birth, they're discharged to home. A birth center may be freestanding, staffed with midwives who are direct entry midwives. It may be freestanding, staffed with certified nurse midwives or even physicians, or it may be attached to a hospital. Typically in a birth center, patients who are eligible for birth center birth are those who are lower risk. Home is another option. There are patients who choose home birth. Home birth should only be chosen or should only be performed if the pregnancy is low risk and if the provider, there is a competent provider there to assist. And that's a safety perspective. There are families who choose to give birth without a medical provider of any type. There are families who have higher risk assessments who choose home birth. They do have the right to make that choice, but as a nurse, it's our responsibility to give them the information about the risk of that choice. Not to talk them out of it, but just make sure they have the information. Birth plans got really, really popular for a while. They've waned a little bit, but some people still want to write a plan of things that they want to happen or not to happen during the birth process. And that's partly because at one time in the US, birth was so medicalized and regimented that women often felt like they were being herded like animals, like they were just herded along, they weren't listened to, their concerns weren't heard. That still takes place quite a bit. We have gotten more cognizant of making birth a better experience. It's not always about the experience. There are some interventions that actually increase risk. And so some people want to avoid unnecessary interventions in order to decrease the risk to them or to the baby. But because of the history of birth in this country, a lot of people will write a plan for how they want the birth to go. And birth plans can be fairly simple, or they can be really, really elaborate. One thing I want you to avoid, a lot of OB nurses, when they see a birth plan, they think of it as a jinx, and they're like, oh no, when they say they have a birth plan, that's a guarantee, nothing's going to happen. I want you to try to avoid that. One thing that we can do, though, is make sure that patients are well educated. Knowledge can actually help them create realistic expectations for the birth. There's nothing wrong with the patient communicating their preferences or their desires or what's important to them about the birth process. But we need to make sure they've got accurate information so that they're not asking for things we know we can't deliver. And so they understand that some things are just out of our control. Okay. Childbirth education, there have been so many different fads in childbirth education. They can vary from really specific programs that are designed specifically to help that patient have an unmedicated birth, to a program that's more intended to inform the patients about hospital procedures, to programs that are focused on teaching women about their choices or teaching patients about their choices. So there's a lot of different variations in childbirth programs. Some of the techniques that are taught for pain management include breathing patterns, relaxation techniques, hypnosis, hydrotherapy, hot bath, hot shower, things like that. Those can be used in place of pain medication in labor. They can also be used in addition to pain medication in labor. It's a good idea to have a lot of tools in the toolbox when we're talking about dealing with labor pain. Okay, we're going to stop there, and the next recording is going to be about nutrition.